Welcome to Prostate Health After 50, Essential Knowledge for Men. I'm Liam.
And I'm Chloe. Today we're tackling a topic that's really vital for men's health,
Right.
but it's often surrounded by silence. Prostate cancer.
It's incredibly common.
Yeah.
And yet the early warning signs are frequently dismissed as, just a part of getting older. We want to change that conversation.
So let's start with the fundamentals. Liam, can you give us a quick anatomy lesson? Where is the prostate and what does it do?
Of course. So the prostate is a small gland about the size of a walnut, and it sits just below a man's bladder.
Okay.
It wraps around the urethra, which is the tube that carries urine out of the body. Its main function is producing fluid for semen.
Right.
And because of that location, when it gets larger or develops a problem, it directly affects urination.
And that's where the first warning signs often appear. But they're so subtle, which is the real challenge, isn't it?
Exactly. We're talking about things like needing to go to the bathroom more frequently, especially at night.
Right.
You might notice a weak or interrupted urine flow, or that feeling like you can't fully empty your bladder. A lot of men just think, oh, I'm just getting older, but this really deserves a conversation with your doctor.
And there are more serious signs that should never be ignored, right?
Absolutely. Seeing blood in your urine or semen is a major red flag.
Wow.
So is new, unexplained pain in your back, hips, or pelvis.
Yeah.
These could be signs that the cancer is more advanced, which is, that's why we stress early detection so much.
It's easy to see why there's confusion. Urinary issues are common in older men. How can a doctor tell the difference between prostate cancer and other conditions like, say, a benign enlarged prostate or BPH or a UTI?
That's a critical distinction. A doctor will look at the full picture.
Okay.
A UTI often brings a burning sensation, maybe a fever. BPH typically just causes those urinary flow issues, but prostate cancer, it can present with a wider range of symptoms, including blood, and they tend to worsen over time. The only way to know for sure is to get checked.
Which brings us to screening. This is the most powerful tool we have. When should men start and what does it involve?
Well, the general recommendation is to start annual screening at age 50.
Okay.
However, if you have a higher risk, like a father or brother who had prostate cancer, you should begin that conversation with your doctor at 40 or 45. The screening process itself typically involves two simple steps. First is the PSA, or prostate-specific antigen blood test.
Right.
It measures a protein that's produced by the prostate.
Okay.
An elevated level can be a sign of a problem.
And the second is the digital rectal exam, or DRE. It's a quick physical exam where a doctor can feel for any hard or lumpy areas on the prostate.
Yeah.
I know many men are hesitant about this, but it's a fast, private, and, a potentially life-saving procedure.
And the importance of this really can't be overstated. When prostate cancer is found while it's still localized, so it hasn't spread outside the prostate,
Wow.
the hopeful 5-year survival rate is over 99%.
That's an incredible statistic. It means that with early detection, treatments like surgery or radiation therapy are often completely curative.
Exactly.
Waiting for obvious symptoms could mean missing that window.
And it's not all just about medical screening, though. Lifestyle choices have a real impact on your risk.
This is the empowering part. What can men do every day to protect their prostate health?
It really comes down to the fundamentals of good health. Eat a diet rich in fruits, vegetables, whole grains, and cut back on red and processed meats. Stay active. Even brisk walking helps.
Right.
Maintaining a healthy weight, avoiding smoking, and limiting alcohol also significantly reduce your risk.
So the message is clear. Be proactive. Don't dismiss those subtle signs.
Yes.
Talk to your doctor, know your risk factors, and embrace a healthy lifestyle.
It's all about taking charge of your health. These conversations and checkups, they aren't something to fear. They are your best defense.
As we close, we want to leave you with a question to reflect on.
We know it can be difficult to talk about personal health issues, especially for men.
Definitely.
Our question to you is, how can we create a culture where men feel more comfortable and empowered to discuss their health openly with their families, friends, and doctors long before a crisis occurs?
Worm. Thank you for listening to Prostate Health After 50.